My name is Samson Ugala. I'm the Deputy County Nursing Officer for Kwale County, involved in coordination of nursing services in this county. So we've had a fruitful discussion on what women and girls want in terms of their healthcare services, and from our position, which is a decision-making level, we looked at our gaps, and the biggest question we've been trying to answer is why do women not access healthcare services, and why do we have incidences of losing women to reproductive health issues as well as children. So what we've come up with is number one, health and well-being involves access to the right information that is age specific for women and girls in their different age groups. This information involves information about health, their priorities and their preferences. Two is about access to healthcare services, and number one is the healthcare infrastructure itself. How accessible are they in terms of distance, in terms of access to women and girls with special needs, in terms of having the right number of healthcare personnel, having the equipment that is required, and also prompt referral services as well as pharmaceutical and non-pharmaceutical products. Three is about funding of healthcare services. How much of our health budget in the county goes to health, and what can we do to partner with other organizations, partner organizations, both donor funded and well-wishers, grants and all that, to just beef up the kitty for health funding. And then lastly is about involving women and girls when it comes to decision making about health priorities and their rights, by creating a feedback mechanism or a communication channel where information flows in both ways, from the county health management team to the grassroots, and from the grassroots and facility level to the county health management team and other organs of decision making within the county. So if I have to prioritize these needs in terms of priority, number one, I believe the access to right information comes on top, because we cannot, or I cannot ask a client to do or to come for a service if they do not clearly understand why they are being told to come for that service. So access to the right information is paramount. Two is now accessibility in terms of availability of healthcare institutions within their reach, and also now the service itself, the service needs for the service, in terms now of funding, in terms of infrastructure, in terms of personnel, and in terms of commodities, in that order. And then touching on self-care, we believe that self-care is important and is paramount to women and girls. And from our level of decision making, I would term self-care as the ability and the involvement of women and girls to actively participate in making decisions and on choices of care to themselves, and also the ability to perform those activities of care on their own, whether with the guidance or help of healthcare providers or when unaided. And that was what self-care is. What as a county and as a department we've been able to do to address these challenges in terms of what women and girls want, number one is on the issue of information. On this information is that as a county we have a fully fledged community health services system, where From the county, we have a coordinator for community health services that runs with structures all through to the village level, where we have community health units attached to dispensaries. With these community health units have community health promoters. So we have a total of around 168 functional community health units in the county, with more than 1,600 community health promoters, and that fosters information flow and health education to these women and girls directly from the village or household level, and the flow of that information within the county level. There is a system of health education across all our 178 healthcare facilities in the county. In terms of all services begin with a health talk or a CME at the beginning of service day. That has gone a long way to impacting this useful information to the women and girls. Secondly is to improve on accessibility to healthcare services and healthcare infrastructure. As a county, since the evolution started, we've tremendously increased the number of healthcare facilities. We started with around 65 facilities in 2014. We are now at 178 facilities, ranging from dispensaries, health centers, sub-county hospitals, and county hospitals. Also, the scope of services has increased, ranging from general services to specialized services within the county. That's number one. Number two, the healthcare workforce has also grown tremendously to present day of upwards of 1,800 healthcare workers, and as a county we've continued to gradually improve, also capacity build these healthcare providers in terms of opportunities for higher levels of training, in terms of sensitization, mentorships and trainings within the county, and that has increased our pool of expertise in terms of health, access to health, especially for women and girls. Thirdly, we have also a system of addressing mechanisms or feedback and monitoring system from our healthcare facilities. Fully fledged with that a grievance redress mechanism, whereby we have a suggestion boxes, we have complaints registers, we have a coordinator for grievance redress mechanisms in the county, and that system is open and information flows from both ways. So that's what we've been able to do. In terms of referral and funding for our healthcare providers, of our healthcare system, we understand that health is a priority for the county. Her Excellency the Governor has prioritized health in her first term as her number one priority. With that, even the funding model, health takes more than a third of the county's budget allocation. But we must understand that health is wide and health is diverse, and that is not enough to adequately fund it. But we've gone as a department, we've gone the private public partnership way. We've been able to partner with many partners, organizations that can support us and can partner with us to improve health in general and funding for health programs and activities, especially maternal, reproductive health, adolescent and young person issues. And we would like to greatly appreciate those partners that have come on board. We continue to explore and invite partners who can come and further support us for the provision of healthcare services. So that is in brief of what we've been able to do as a county, and we've said going forward that the focus for the department is not to build any more healthcare institutions or facilities. Rather, it is to improve the existing facilities in terms of infrastructure, in terms of supplies, in terms of equipment, and also to beef up the number of our health service providers. So that is the focus of the government and the county government of Kwale going forward, so that we effectively take care of the needs of girls and women in our